Hello, Luvbay family, and welcome to Wild Card Tuesday on the Mental Health Hour. I'm your host, Felicia Fishoff, registered psychotherapist and founder of Rooted in Resilience Psychotherapy and Wellness. Tonight's episode is titled Your Body, Your Voice Navigating Healthcare with Confidence. This is such a vital conversation, especially for racialized communities who have too often felt overlooked, unheard, or dismissed in medical spaces. I'm honored to be joined by Dr. Duarte Adegbit, a family doctor and the CEO and co-founder of Imana Health Incorporated. Dr. Duarte has a special interest in women's sexual and reproductive health, and through Imana Health, she is committed to providing women with simple, accurate, and accessible health information, empowering them to take control of their care and advocate with confidence. Before we dive in, I want to pause to recognize two important moments. Today is National Day for Truth and Reconciliation, a day to honor Indigenous lives lost, uplift survivors, and commit to listening, learning, and taking action toward justice and healing. It is also the last day of Suicide Awareness Month, a reminder that our voices and conversations matter in breaking silence, dismantling stigma, and letting people know that they are not alone. So, a quick reminder: this show is for educational purposes only and is not a substitute for medical or therapeutic advice. Please consult your own healthcare provider for personalized care. And of course, the chat is open, so don't be shy. Drop your thoughts, reflections, and questions as we dive into this powerful and timely conversation. Dr. Duarte. Girl, I am so sorry I butchered your
Hello.
name. I tried. Chad. I tried.
It was a good effort. It was
I
incorrect,
tried.
but
I
you tried.
tried. I
That's all
know.
that we can
Say it
do.
properly, girl. Say it properly so everybody knows how to say your name.
Yeah, a dignity.
Adegbite. I am so
Exactly.
sorry, child. I
Oh, no
tried. I
problem.
tried.
Yeah, I knew you were talking to me, so
All
that's all that
right, good.
matters.
All
Yeah,
right. The love is there. The love is there.
exactly. Always.
And thank you so much for joining us tonight on
Mhm.
the Mental Health Hour. I've been so excited. I was like, oh my gosh, I can't wait for this Wild Card Tuesday to
Yeah.
have you with us. You are
Mhm.
a phenomenal voice in our community. And, we are so honored to have you here tonight. And, I usually start off, the Mental Health Hour by asking, why does the Love Bay family need to hear more about this topic tonight?
Absolutely. I think you and I personally have had discussions about
Mm-hmm.
this, but I think especially as it relates to Black health, Black
Yes.
women's health,
Mm-hmm.
people, unfortunately, I don't think have the tools that they need to best advocate for themselves in our current healthcare system. And,
Yes.
there's so many issues in our healthcare system, frankly, for everybody in these times. Like,
Mm-hmm.
we're dealing with a pretty fragmented system, but I think it's just so important for Black people, especially, to know what to ask for, how best to advocate for themselves, and what they need
Yes.
to do to best take care of their health. Like, we unfortunately are at higher risk for so many different conditions, and
Yes.
without that information, it's really hard to make the best decisions possible.
Absolutely. And I'm just so happy that we're talking about advocacy because this is something that comes up in the therapy room where, I talk
Hmm.
to clients about what it means to advocate for yourself,
Hmm.
right? So,
Absolutely.
why do you feel like some of us hesitate to advocate for ourselves in these spaces?
And I know you know the answer, but I think there's just so many
Chat.
different reasons, right? I think
Yeah,
this
of
probably comes
course.
up in so many of your sessions with your
Yeah,
clients. But
yeah.
we have these kind of this colonial structure to our healthcare system, and
Hmm.
when you don't see yourself represented in your healthcare professional, in your doctor,
Yeah,
in who you're speaking to, the structures that we currently exist within don't really make it that you might feel comfortable speaking to
Yeah.
someone who you might view as an authority figure or someone
Mhm.
with more knowledge than you know,
Yeah.
and if you don't have the right information or the right language, it can be pretty intimidating to,
Absolutely.
feel comfortable asking clarifying questions. Like
Mhm.
so many times people, and I'm trying not to do it now, but I think a lot of the times people use a lot of jargon and really complicated words, and you're like, you leave the appointment like, what's going on? Or people give so much
Yep.
information. Like I think a lot of doctors are really guilty of that. There's like 7 follow-up
Mhm.
things for you to do. And they're like, okay, see you later, right?
Absolutely.
So it's
Yeah.
just, it can be really hard in a really quick appointment where you might have felt dismissed and rushed, to feel that you have the
Yes.
power to actually ask for more information and make sure you got as much as you could out of that appointment. So I think it can be
Mhm.
pretty intimidating. So I definitely appreciate, it can be
Absolutely.
hard for a lot of people.
Absolutely. I know that some things that have kind of come up quite a bit in the therapy room is, I don't know what shifted. Maybe you have more
Mm-hmm.
insight. But, there has been a trend now where clients are only allowed to talk about one
Mm-hmm.
thing per appointment, which before you could just share everything that's kind of
Mm-hmm.
happening. But now it's just like, nope, choose one thing or rebook an
Mm-hmm.
appointment. So, that leaves so many people feeling like dismissed or like
Mm-hmm.
unheard, you know? What happened, child? What happened?
Yeah, the one issue per visit. I think
Yeah.
it's really, you see that a lot more in walk-in clinics, right? It's that
Yeah.
fee for service model, right? Where the doctor's only being billed for the
Yeah.
time that they see you. Um, and so
Mm,
people don't really have the time, I think, to really
yeah.
spend time with people and kind of get into all
Yeah.
of the concerns people might have. And unfortunately, we're in a
Yeah.
system where more and more people don't have a family doctor. Like, I think some people's family
Yeah.
doctors as well might do the one visit per, or one issue per visit.
Yeah.
But I know in my previous practice, I didn't, but I
Yeah.
wasn't in
Yeah.
that specific billing system. So I
Yeah.
think for me, it was really important to get people's list of concerns at the beginning of the visit and then target as
Yes.
many as we could, but figure out what's your most
Yes.
important issue? What are your most important like
Yeah.
top issues? Um, and
Yes.
try to just get through as many as we can in this appointment. But
Yes.
unfortunately, I don't think it's doctors not wanting to really provide the best care. I think it's just a symptom of a crumbling
Yeah.
healthcare system, which doesn't properly allow
Mm,
people to really have comprehensive care.
absolutely. Absolutely. Thank you for sharing your
Mm-hmm.
insight. As you were sharing, I was thinking at the back of my head, like, when you go for that one
Mm-hmm.
thing, a lot of times, okay, maybe I'm talking for myself and my own experience, but it takes me a long time to go to the
Yes.
doctor. Like, if I'm going, that I
Mm-hmm.
feel like I'm
Yes.
dying. So
Oh no, Felicia.
so I come with my laundry
Wait till you're
list,
dying.
right? I come with my I was like, okay, all right,
Oh my goodness.
right? And I don't know why I have this
I don't
class,
think you're
but it's
alone in
just
that.
the way that I'm
Yeah.
wired,
Yeah.
right? So then by the time you go, and then it's like just one
Mm-mm.
thing, and you're like, okay, which one? Well, do I think I'm actually not going to make it through? So then
Exactly.
I feel like that creates an additional
Mm-hmm.
barrier for many of us who already like avoid
Mm-hmm.
seeing the family doctor on a regular
Yes,
basis, right?
absolutely.
You
And I
know.
think especially too, like if
Hmm.
so many doctors have really large practices. So if it takes you
Yeah.
6 weeks to get in to see your doctor, you might have accumulated a bunch of different concerns. So you waited 6 weeks and now you can only talk about
Yes.
one issue. That it just
Yes.
our system doesn't make any sense. I think we need to just rebuild from the ground up, like burn it down, rebuild it. Let's think, like let's be innovative
Absolutely.
instead of just continuing with this model that we've been following for decades. Like this is not
A-
what's serving the current like 2025 patients the best. We can't just keep doing the same thing and expecting different
Absolutely.
results, right?
Absolutely. And I think we need to dream
Yes.
again, right? Rebuilding a
Hmm.
system with us in mind this
Exactly.
time.
Exactly. So,
Mm.
any policymakers listening, please get on
All
that.
right. I want someone to put in the chat, challenge accepted. If
Please.
you're a
Yes.
policymaker, come on,
Yes.
voice up.
We need you. Because obviously this is not
Absolutely.
working. What
Yes.
we're doing is not working for people at
Yeah,
all. Not working for
absolutely.
patients or
Especially for the
doctors.
most
Exactly.
vulnerable. Ab-
So,
Absolutely. Absolutely. So, what are the dangers of not
mm.
advocating for ourselves?
Unfortunately, I think we see
Mm,
this all the time, but let's say you have four concerns, right? When you go to the doctor, and the one that's
yeah.
most important to you is maybe not the one that's the most dangerous in terms of your health.
Yes.
And you don't get a chance to get to it.
Mm-hmm.
Maybe it's like, a weird rash
Mm-hmm.
or like a lump,
Yep.
and you're not really that worried about it. But if the
Yeah.
doctor was aware of that concern, maybe that's one that they would prioritize. So I
Yep.
think that when you don't advocate for yourself and ask
Absolutely.
questions, symptoms can get missed, and symptoms can be for really dangerous and potentially, in some cases, like fatal or deadly conditions. You know, I think that
Absolutely.
when people don't have the opportunity to talk about things that maybe, like, let's say you're getting headaches all the time, you're like, oh, it's not a big deal. Like, I'll deal with
Yes.
my foot pain instead. But it's
Mm-hmm.
like, maybe you're getting headaches
Yep.
all the time because your blood pressure is incredibly high, which we know in Black people,
Mm-hmm.
we're so prone to, we're at increased risk for high blood
Absolutely.
pressure, for hypertension. So maybe you don't talk about
Yep.
that, but it's actually a symptom of really
Yeah.
bad high blood pressure, which could lead to like heart attacks and strokes. So I think that when you don't have the
Yes.
opportunity to really talk about everything that you're dealing with, and especially mental health, right? I think that in our
Yeah.
communities, people aren't as open. It's getting better, I think, but people aren't as open to talking about mental health. And mental health affects not
Yeah.
only your mental health, but your physical health. And that can have
It's
devastating,
all
exactly.
connected.
And that can have devastating
Mm-hmm.
consequences as well. But if you don't feel empowered enough to talk about maybe how you're feeling, and maybe you're feeling really low or having, really dark thoughts,
Yes.
then how can you get the care that you need? And this can potentially be deadly
Absolutely.
in both mental and physical health
Absolutely.
conditions. So I think that's a huge issue, and part of the reason why, unfortunately, Black people, like I said, we're prone to so many different health conditions.
Yeah.
And a lot of those conditions can be more serious in our communities. And I don't know that it's
Yes.
completely just the way that we're built. I think it's a lot of the systemic racism and people not feeling that they can
Yeah.
advocate for themselves. It's part of the reason why,
Yeah.
we have higher rates of mortality from breast cancer and more aggressive breast cancer, because things are caught later, right?
Yes.
Like, people don't
Exactly.
advocate for themselves or don't feel comfortable advocating for themselves, and then it takes that much longer to actually be diagnosed. So there's so many social
Absolutely.
factors in our health
Yeah.
conditions and how we experience them, and just getting
Mhm.
treatment for things like, Black maternal mortality is so much higher in Black
Yes.
people. Like, there's just so, to
Yeah.
answer your question, that was a very long answer.
Yes. No,
There,
girl, I'm with you. I'm
exactly.
tracking with
But
you.
there's so
Yes.
many
Yeah.
consequences when you don't feel comfortable advocating for
Yeah.
yourselves. And unfortunately, they can be deadly.
Absolutely. And, I know that I've heard of many, many, many people sharing that there are times that they do actually voice up their opinion and they're still
Mm-hmm,
dismissed and they have to
mm-hmm,
fight to get the treatment that they need,
absolutely.
right? I've heard of people telling me their stories of having like blood clots in
Mm-hmm,
their leg and they're sending them
mm-hmm.
home and they're like,
Right.
no, you need to look at, because something is wrong with
Mm-hmm,
me. And then they find the blood clot and they get the
yeah.
treatment. But it, so when we think about like the dangers of not advocating for self just on the day to
Mm-hmm,
day, right? Much less in those moments when our concerns aren't being taken
mm-hmm,
seriously. Like there's just so much
mm-hmm.
danger.
Absolutely.
Oh, Chad. Mm. Mm-mm.
Yeah. And I think it's such a hard fix because, like you said, like you've, pointed out, even when people do feel comfortable advocating for themselves, sometimes they're not heard or they're dismissed. So it's like, even if you have the tools to know what to say, know what to ask, if you're still being dismissed and potentially having these horrible consequences, then it's like, what else can you do? So I
Yeah.
think there's only so much that we can do. It's like the system needs to be
Yeah.
providing us with equitable care. And your race should not
Absolutely.
matter, you know, in an ideal
Hmm.
world, and not so I suppose
Yes,
this patriarchal community that we or society we live in. But
absolutely.
ideally,
Absolutely.
everyone's getting equitable care, and the color of your skin isn't impacting how serious your concerns are taken, or seriously your concerns are taken,
Hmm.
which unfortunately is not the reality of the world we live in. Like for me, if I go, let's say, to the emergency
Yeah.
department, I don't tell people I'm a doctor, so I'm
Hmm.
treated like any Black woman, and often it's
Yeah.
not good, right?
What? You don't pull the doctor
Yeah,
card?
yeah, I don't.
Girl, I'll be waving that like a flag.
Wear
I'm
my
like, I'm
stethoscope.
a
Yeah.
doctor, by the way.
I go with my scrubs and my stethoscope, put a white coat on. And frankly, if I did, I'd be treated better, right?
It's true.
Right. But I don't, because I'm like, I shouldn't have to say that I'm a doctor to get good care,
One hundred
right? Not
percent.
everyone, like I'm in a privileged position where I am a doctor. I know what to ask. I can advocate for myself, but most people
Yeah.
can't. So I don't use that as an extra card. I'm like, I just expect to be treated well. And I can tell
Hmm.
you from my personal experiences with our healthcare system, that is not the case.
Yeah.
Even when I know I know the
Absolutely.
terms, I know the medical terms, I have the language, and people's bias is
Mm.
it's just so it's wild. Yeah.
Yeah. One hundred and ten
Mm-hmm.
percent. Right. So I love the way that our episode is titled tonight. Your
Mm-hmm.
body, your voice. When you think about this title, like what does that mean to you as a physician, as a Black woman who doesn't wave the doctor card when she's getting treatment?
Yeah.
Right? Like what does that mean? Your body, your
Mm-hmm.
voice.
I think that really just speaks to what we've been talking about in terms of advocacy. Like, nobody cares about you and your health more than you do. And so it's so
Yes.
important that you find it within yourself to speak up for yourself, because you are your own biggest advocate. No one can be a bigger advocate for you than you are. And you're the only
Mm,
person, well, not the only person, but you're the main person who's going to suffer consequences if you don't at least try to advocate for yourself and
yeah.
demand the care and, you know, clarity that you deserve. So I just
Mm-hmm.
think it's so important that people remember, if something feels wrong, if you're being dismissed, you know, get that second opinion. If something doesn't feel right, you know your body. No one else is living in your body, right? Even if you don't
Absolutely.
know what exactly is going on, if something doesn't feel right, it probably isn't. Like, trust your own intuition
Yeah.
and, you know,
Yeah.
get the answers that you should be able to, like that you deserve, because we all deserve, like, I think healthcare is a right, it's a human right, and we all
Mm,
deserve to
mm-hmm.
have access to good healthcare. And we're in a country where that exists. It's just it's hard to get access, and access is obviously not equitable
Yeah.
across this country by any means, and it's so much worse for people of
Absolutely.
color. But at the end of the
Hmm.
day, like, not speaking up or being a bit nervous to say something, it's only going to be
Yeah.
harmful to you. So trust yourself.
Mm-hmm.
You know your body. If something's not right, like, seek care. And I know it's hard, I think easier said than done to just not be nervous and
Mm-hmm.
not be intimidated. But I think it's about pushing through those barriers, working with an amazing psychotherapist such as yourself, you know, to just go get the self confidence and feel that you
Yeah.
are able to speak up for yourself. And I think because of a lot of,
Absolutely.
you know, people's histories of trauma or just lived experience, people might not feel that they can. And so when people
Yeah.
do are able to have access to a psychotherapist, I think it's so good to learn some of those tools to really better speak up for yourself.
Absolutely. And I love that you talked about getting a
Mm-hmm.
second opinion because I think that a lot of us we see it in the
Yeah.
movies. Oh, I'm going to get a second opinion. But I think in reality, like we don't really um, take that
Mm-hmm.
seriously that we have the right to get a second
Mm-hmm.
opinion, and that's
Yeah.
okay.
And I think it's quite common for people of color and Black people, and especially like immigrants, to not feel that they can get a second opinion. Because I can tell you, There are many people getting second opinions. They just don't look like us.
Girl, can you
Yeah,
say that again for the Love Bay
exactly.
family?
So, you have to take on that self-confidence. And if you don't
Yes.
feel happy with the answer you've gotten or things don't feel right, ask for a second opinion.
Yes.
And I think the nice
Absolutely.
part about therapy is working with someone to help you not feel embarrassed or ashamed by someone else's reaction to you, right? Like, I think people might
Mm,
stop themselves from getting a second opinion because they're like, oh, this doctor is going to be mad
yeah.
at me or annoyed with me
Yeah.
or frustrated with me. Like,
Mm-hmm.
you're worrying about someone else's reaction to you when you should just be
Yeah.
worrying about your own
Yeah.
health, right? But I think that's something that
100%.
you really, it's so helpful to work with someone else outside of yourself to build those
Mm-hmm.
tools and build that, that thought process.
Yeah.
Because why are we,
Yes.
so many of us are more worried about how someone else thinks of us than
Yeah.
ourselves. It's like
Yeah.
you personally could die and that person would just be annoyed. Like, this isn't,
Yeah.
one of these is way more important than the other, right? So,
One hundred
mhm.
percent, 100%, right? It's like either the people
Yes.
pleasing
Yeah.
tendencies is like, oh, I don't want to disappoint the.
Hmm.
We're loyal. We're loyal sometimes to a
Right.
fault. If we love somebody like a
Hmm.
doctor or we, unless they do something like they misplace our
Uh-oh.
kidney or something, we are not. We're not switching. We're very like
Hmm.
committed. But if you're finding that in your
Hmm.
commitment that things are getting missed or
Hmm.
overlooked, just go down the street and try to book an appointment with someone
Exactly.
else.
And I think it's a thing to remember, right? Like, we're all human, right? Doctors make mistakes too. People have busy days, people
100%.
have bad days.
Yeah,
A lot of doctors
100%.
are incredibly overwhelmed, but with the amount of
Yeah,
administrative tasks and running a business
yeah,
with no business experience and seeing,
yeah,
being forced to see like 40 people a day. So
yeah,
sometimes things just fall through the cracks or things are missed, not through anyone
yeah,
trying to provide anything but the best
yeah,
care, but if things don't feel
100%.
right or you're not happy with the care you're getting, I think that you should feel comfortable asking for a second opinion.
Absolutely. And I'm so glad that you shared that doctors are
Hmm.
human.
Yes.
I think we need to humanize that they make
Yeah,
mistakes.
absolutely.
Just like any other profession,
We
we
all make
all make
mistakes.
mistakes,
Exactly.
right? And so things could get
Hmm.
missed. And yes, of course, you guys are a lovely,
Hmm.
lovely, and you guys are well educated,
Yeah.
big up all the doctors out there that's listening, right? Y'all went through all of those
Yeah.
exams and, you went through med school,
Hmm.
residency, but you're still
So human.
human,
Last I checked,
right?
not an
And
AI
human
scribe yet.
mistakes.
So,
Yes,
not a robot.
right?
Yeah.
Absolutely. Absolutely. So it's okay to
Hmm.
question and it's okay to be like, are you sure that you didn't miss
Exactly.
something? Or have you considered this because I'm feeling this
Hmm.
way? You know? And please, it's better to do this than to resort to the medical school of
Right. Or
WebMD
chat GPT.
or
Past TikTok.
ChatGPT.
Yes.
Right, or
Yes.
TikTok, right? It's better to seek out a
Hmm.
professional, and if you have to go to more than
Hmm.
one, because I mean, when we're doing research, we don't just go to one site and be like, that is
Hmm.
it. We usually look up at least two to three to kind of see if they're all saying the same
Hmm.
thing. So why don't we do that in
Yeah.
real life?
Especially if you're not happy,
It,
right? Hmm.
yes,
Yeah.
absolutely, absolutely.
I completely agree.
Mhm.
Hmm.
Right? It's so important.
I think
It's so
it's one of those
important.
things that it's, I think, hard in Canada, like the way our healthcare system is built. I think it's a bit easier in places like the States,
Yeah.
right? Like, if you're paying
Hmm.
with your private insurance,
Yeah.
you can get as many opinions as you want. As long as
Yeah.
you're in
Big up
your,
our U.S. brothers and sisters that are tuned
yeah,
in.
like as long as they're within, I don't know the details of the American healthcare system, but if they're in your network
Yes.
or that kind of thing, like you don't need a
Yeah.
referral to see certain specialists. So I think it is a bit
Yeah.
harder in Canada because of the way our system is set up.
Yeah.
But I think
Mm-hmm.
it's still important that if you're
Yeah.
not happy or your questions aren't answered or you just don't feel like you trust that person, that you try to seek another
Yes.
opinion. Yeah.
Absolutely. For um, clients who may be, or individuals listening who may be waiting on a specialist,
Mm-hmm.
but things are just getting worse, what should they do? Should they just sit there and wait for the specialist appointment 4 months, 6 months down the line?
Oh, Alicia, that is a difficult question. Yeah.
I
I
know.
think
I
I
know.
think unfortunately like 4 to 6 months, because like 4 months, oh, what a great wait time. Um,
All
yeah.
right.
I think that
I was being
oh, that's no,
generous.
that's ideal. Like some specialists, looking at 6 months, a year, 18 months. So 4 months, I was like,
Yeah.
ooh, short. Um, I
Right?
think that if you're blessed enough to have a family doctor that you trust and
Yeah.
you feel comfortable talking to, we're often the
Mm-hmm.
point where we are managing people's symptoms until they're able to see the specialist, right?
Yeah.
So I think that's kind of your first step, but you probably already saw your family doctor because they're likely the one who did the referral to the specialist. So presumably you're probably already
Yes.
working with them to like manage symptoms. Um,
Yes.
but that's really like the way our system is built. So usually they're kind of trying to manage things with you. Um, the
Yeah.
nice thing too is that we do have like e-consult. Like as a family doctor, we have e-consult services.
Yes.
So,
Yes.
oftentimes
Mm-hmm.
we'll electronically consult a specialist and then we can get a response within a day or two,
Yeah.
right?
Oh,
Right.
okay,
With just like
great.
advice for things to do.
Mm-hmm.
And then they might be like, try
Mm-hmm.
these things. If it doesn't work, do a referral or try these things while
Okay.
waiting to be seen in person by the specialist. So I think a lot of family
Okay.
doctors utilize that as well, just to kind of get some tips in terms of how to help people while they're waiting to see the specialist. So, that's something that if your
Mm,
doctor is not doing that, you might even ask about that. Like, are you
yeah.
signed up with like the e-consult, it's called OTN service, like to just get a quick electronic consult just for some ideas beyond what we've already tried. So I think,
Yeah.
that's something else to explore. But I really empathize with people. I think that unfortunately our wait times are long. We don't have enough of many specialists and our population is just
Yeah.
growing and growing, but we're not keeping pace in terms of specialists.
Yeah.
So their wait times they just get longer and longer, right? Because you have more people being referred to the same number
Absolutely.
of people. So
Yes.
yeah, it's a really hard situation, and I
Hard
think a
one.
really, really common one,
Yeah.
especially for things to do where the person's in pain, right? I think that's really hard to
Yes.
it's really hard to watch. Yeah.
Yeah. Absolutely. Absolutely. And I know that we've been talking about like going to your family doctor. But like I know that right now, especially where we're
Mm-hmm.
located, there's been a shortage of family doctors right
Mm-hmm.
now for a lot of people who are still looking after like months of just not being able to. Everyone's full, or there's the new ones coming in.
Mm-hmm.
It's taking them some time to write their
Yeah.
exams and stuff like that, right? So, what would you say to others out there who may not even have a family doctor, but they feel like there's something wrong with their
Mm-hmm.
body and they're wanting to get that looked after?
Absolutely. No, I think it's a huge issue. I think something like over 2 million people in Ontario don't have a family doctor. It's supposed to, I think, double by next year. So
Yeah.
it is a really tough
Wow.
situation. I think in the GTA, at least, we're pretty lucky in terms of having a
Yeah.
lot of walk-in clinics. So, you know,
Yes.
and that's not the case in many parts of the country. So at least, even if it is
Yeah.
still just that one issue per visit, you can usually see someone to address a
Yeah.
concern, like a pressing concern. You don't really get that preventative care,
Yeah.
but I think it's better than nothing. And
Hmm.
so we do have a lot of walk-in
Hmm.
clinics. And I think as well, um, places that have nurse practitioners, like many nurse practitioners are very
Hmm.
well trained and provide primary care, like at the same doing the same things as a family doctor, especially in things like community health managers and
Yeah.
that kind of thing. So I know there's some patients who are like they're offered the visit with a nurse practitioner, like, no, I want to see the doctor. Many nurse practitioners are excellent,
Yeah.
and I think it's a great
Yes.
resource because of the shortage of family
Hmm.
physicians. So I think people should. I would really
Yes.
encourage people if you have access to a nurse practitioner at your clinic or
Mm-hmm.
in general, I would definitely take advantage of that. They're a really good
Yeah,
resource as well for people.
absolutely. So take
Take
advantage
advantage.
of the nurse
Hmm.
practitioners out there,
Yes.
right? Because as you're navigating, time is time is
Hmm.
currency. And especially as it relates to for I mean that's across the board for a lot of different things, but
Hmm.
time, our health is currency,
Hmm.
right? And so we don't want to waste time as it relates to our health, our life
Hmm.
expectancy.
Yeah.
Like if there's things that are wrong, we need to make sure that we're getting attention, whether that's physically,
Hmm.
emotionally, like even
Yes.
spiritually, like it's all
Hmm.
encompassing, you know?
Absolutely. Yes. But I think
Hmm.
I just see so many people being like, I don't know if I'm a nurse practitioner. I've been blessed. I've worked with so many good ones. So just another plug for nurse practitioners. There are so
Yes,
many excellent ones. Like, please, if someone offers you an
yes,
appointment with a nurse practitioner, see them. Yeah.
yes. Any nurse practitioners out there, pick up yourself
Yes.
in the chat, okay?
No, great. It's a great resource. Yeah.
Absolutely. You know, a thought that just kind of
Hmm.
came to mind was how do we teach our next generation to also advocate for themselves in this medical care system,
Hmm.
right? So, how do we teach our kids or our youth that your body is important, your voice
Hmm.
matters, and you need to voice up your concerns
Hmm.
if something feels off?
Yeah, I think kind of more generally, it's about teaching and instilling in younger people self-confidence, right? So not even necessarily
Mm,
specific to your health, but I think that if you,
yeah.
from a very young age, have self-confidence and it's somehow
Mm-hmm.
maintained through adolescence, which is such a hard time for
Mm-hmm.
everybody, for many of us, I think that if that's
Yes.
instilled in you and maintained, you're more likely to be able to advocate for yourself in many different areas,
Yeah.
not just your health, but also,
Mhm.
at school or in different types of
Yeah.
relationships. So I think that as a life skill, like just self confidence and feeling like your voice matters and that you have
Mhm.
important things to say and that should be listened to. I think that transfers to advocating for your health as well as many other types of advocacy. That makes sense.
Absolutely.
Yeah.
That makes a lot of sense. And that brings us to that voice piece.
Hmm.
We have a voice, and it takes
Exactly.
confidence to use it,
Hmm.
right? And I know that in a lot of spaces, it can feel like people don't listen to our voice.
Hmm.
Or if we use our voice, they misconstrue it as, like, I don't know, mad black woman or what,
Hmm.
but your voice matters and it holds weight.
Exactly. Yeah, I think don't be afraid. Again, I think it's talking to that point of worrying about how other people view you. Like if
Yeah.
you try to make yourself smaller, such as a black woman, or softer or more passive because you're so worried about someone viewing you as an angry black woman. Why are you
Mm,
again worried about that other person's opinion of you? Like, who
mm,
cares, right?
yeah. Yeah.
Easier said than done, but sometimes some of us just have different ways of speaking and it might be a bit more blunt and
Hmm.
some people might say abrasive, but who
Yeah.
cares? Get your point across the way that is natural to you and don't care how other people view
Hmm.
you, you
Hmm.
know?
Hmm.
Especially I think there's so many cultural differences, right? Many of us come from cultures where people do speak more maybe forcefully or loudly, and that's not
Yeah.
necessarily the way that North American, Western culture is built. And so
Hmm.
should we be trying to fit that mold, or should we just be
Hmm.
authentic to ourselves and people can
Yeah.
just deal with it, right?
Absolutely. You're absolutely right. Like we have to be confident in ourselves,
Mm-hmm.
regardless of what other people think. And it's hard. It's very
Mm-hmm.
hard. That's not easy, right?
Yeah.
But you could do all the right things in this life, and still someone could either misjudge you or
Mhm.
misunderstand you, or you fill in the blank, right?
Exactly.
And it doesn't take away from the fact that your voice still matters,
Mhm.
period.
Yes. If someone's not going to like me, I'd rather it be while being my authentic self versus trying to be something to please them. They still don't like you anyway. So might as
Exactly,
well just be yourself, right?
exactly. And
Yeah,
be a healthy, authentic self at that,
exactly. Exactly.
right?
Yes. And stand up for yourself.
Absolutely.
Yeah.
Absolutely, right? And it's okay to stand
Mhm.
up for
Absolutely.
ourselves, right? And yes, people may not like it, but
Who cares?
is that really a us
No,
issue
it's a
or
them
is it a
issue.
them issue?
I can't lose sleep over that.
100%. Mm, right.
I think also it comes
Absolutely.
with, getting older as well. I think many people become more comfortable in their skin as they get older. And I
Yeah.
think you have less F's to give as you get older, which is a blessing. And I
100%.
want people to have that when they're younger.
Honestly, that how do we teach it? I guess we have to show it,
I mean,
right? I don't know.
you have to come see you for therapy so you can help people get
How
it into
you
their
know? How
system.
you know?
Yes.
100%, having that
Hmm.
accountability, right?
Hmm.
And having people hold us accountable to not be afraid to express yourselves. And then in even in medical spaces, like what do you think about getting like even like our family and friends involved if we feel like it's a struggle for us to advocate for
Hmm.
ourselves? Like what do
Hmm.
you think about inviting others in our community to help us advocate if we feel like we're not getting anywhere?
Absolutely. That's one of the tips that you often tell people is taking a support
Mhm.
person with you to appointments. So I think so many times it can feel overwhelming, especially a specialist appointment that you've been waiting for months, and you can be quite nervous.
Yeah,
And then it can be
absolutely.
information overload. They tell you all these different things. You're already nervous. You're going into it. Um, just feeling
Hmm.
overwhelmed. And so oftentimes it's hard to really pay attention to the multitude, like the many, many, many things that they're saying. So I think
Hmm.
having someone there with you who knows what your goals are, who maybe can
Yeah,
ask the questions that maybe you forgot to ask, or you're just, you're too overwhelmed and feeling too nervous to get those points
yeah,
across. They can do that for you. And they
absolutely.
can also, I think it's so helpful to have a second person to help remember things. Maybe someone's taking
Yes.
notes for you, or
Yeah.
just helping you digest the massive amount of information that you might get. And I think
Hmm.
it's just also a comfort, right? Like it could be a really scary
Yeah.
scenario, and just having someone who you trust and makes you feel
Hmm.
comfortable and makes the
Yes.
situation more just better, overall.
Yeah.
But I highly recommend people have a support person that they take if they feel that they need one,
Yeah.
especially for things like, I work a lot in sexual health. So when we're doing
Hmm.
really sensitive exams or kind of
Hmm.
uncomfortable appointments, like you
Yeah.
shouldn't feel awkward about
Hmm.
asking to bring someone else in if you feel like that would be helpful for you. Um,
Yeah.
I think that it can be so helpful to have a support person. And even sometimes, depending on who the person is, sometimes they're adding to things of the history that the person forgot. I'm like, oh, well, that's helpful, So I
Yeah,
think it really is
absolutely.
it's so individualized, but I think people really should feel comfortable bringing in a family member if they feel that would be helpful to them in a
Hmm.
medical appointment.
Absolutely, right? There's
Hmm.
power in numbers, there's power in
Hmm.
community, especially when it
Exactly.
has to do with like our health. It's already a vulnerable situation, right? And
Hmm.
so, in that vulnerability, it does help to have someone there to, as you said, like maybe remember something that you may have
Hmm.
forgotten, or just
Yes,
their presence makes you feel a little bit more comfortable and at ease.
exactly.
Hmm.
Hmm. Absolutely.
You know, when because I know that your um, area of expertise is reproductive
Hmm.
health, right? And so, what are some things that you've noticed that a lot of people overlook or miss when it comes to their reproductive health that you wish that they would advocate more for?
Hmm. I think there's probably a lot of things, but two that come to
Mhm.
mind. Um,
Yeah.
one is people just overlooking symptoms that they
Mm,
think are normal. So, for instance, I see so many Black women, especially, who
yeah.
have the heaviest periods you've ever heard
Girl.
of.
Mhm.
And they're like, that's what they've always experienced. So they're just like, this is normal because it's normal to them, right?
Yeah.
And
Mhm.
people often don't really talk about that, with their friend, like, how
Yeah.
was your period? Like,
Yeah.
so people aren't really comparing that
Right.
information. And so they think
Yeah.
it's normal. Um, and they think it's normal to have incredibly low iron
Yeah.
or all these symptoms. And it's like, or incredibly painful periods, like just
Mhm.
they can't go to work, they can't go to school. And
Yeah.
because they've always experienced that, they think that's normal. And those things aren't normal. So that is something I just see so often
Yeah.
that I think it's in some communities it's just normalized. You have all these tips to deal with it. But it's like, no, what you need to do is see someone because something else is going on. You know, you
So I
shouldn't
just,
be leading out. Go ahead.
yeah. I think he just blew some women out of the water right now. They're just probably leaning in and be like, "What did you say? That's
Yeah,
not normal." I think you
yeah,
need to expand on that because
yeah,
a lot of us have been told that, "Oh, you just bear it."
yeah. No, like if
Mhm.
you are having ridiculously heavy periods, Black women were way more likely to have fibroids, right? So fibroids being those completely benign, so not
Mhm.
cancerous, but those benign
Mhm.
growths in the uterus. They're common in all women. Like
Mhm.
70% of all women in
Yeah.
menopause will have fibroids, but it's so much more
Mhm.
common in Black women, and we get them earlier, and they grow faster and larger, and they can cause
Mhm.
so many symptoms. So it's those super heavy
Yeah.
periods and peeing all the time, and just like all these symptoms.
Mhm.
And when people have experienced symptoms for so long and have been told me by someone that's normal and don't worry about it, you just grin and bear it, they might not be actually
Mhm.
accessing care to help treat those fibroids. And for some people, it's surgery, it
Yeah.
could be medication,
Mhm.
but there are
Mhm.
treatments. Like, you don't need to be
Yeah.
bleeding out every month and missing school and missing work. Like,
Yeah.
that's not normal. Missing things because of your
Yeah.
period is not normal. So I
Yeah.
think when I think of reproductive health and something that's often overlooked, I think that's a big one. Like, people thinking that their
Wow.
symptoms, especially around people's periods, that's normal. And it's not. If you are in so much pain that you're
Mhm.
missing school or work, you need to see a doctor. That is not normal.
Mhm. Girl, what about emotions that come along with it? Because some women be mood
Mm-hmm.
swinging like crazy. Is that normal too?
I mean,
Because from a mental health
mm-hmm,
perspective, it comes up quite a bit.
absolutely. So I think it depends on the severity of the symptoms, right? So PMS or
Mhm.
premenstrual syndrome, that's really common,
Mhm.
right? With the
Mhm.
shifts in our hormones during the cycle and then right before a period,
Mhm.
things can get a little dicey before your
Yeah.
period. But if you're
Yeah.
having symptoms of like major depression before your period or
Right.
thoughts of suicide,
Mhm.
that's not normal. That
Mhm.
could be PMDD, so
Yes.
premenstrual dysphoric
Yeah.
disorder, which you need to see
Yeah.
someone about, right? That's not something to grin
Mm.
and bear and just hope for the best every month. Like, that's what you need to see
Yeah.
your family doctor or a mental health professional, or a
Mhm.
psychiatrist, because PMS is one thing,
Mhm.
like feeling a little moody
Mhm.
before your period,
Yeah.
but
Mhm.
clinical depression every cycle needs to be assessed.
Yeah.
So, and that's a good point. That's also something
Absolutely.
that people overlook. When anything, I think
Yeah.
with anything, right? When you experience something for a long
Yeah.
time, and you normalize it, and you're like, oh,
Yeah.
this is
Yeah.
normal.
It's just the
It's the
way
way
that
it
it
is. But
is.
then many times
Right.
it's not. You need to seek
Yeah.
care.
Right.
Yeah.
Absolutely. Absolutely. And I think that sometimes we try to fit ourselves in certain boxes. So oh, they said that you get mood swings with
Mm-hmm.
like your period, right? So this must be what it is. But if it's severe
Mm-hmm.
and you know it's severe and you know that there's a something that isn't
Mm-hmm.
right, you have to say something.
Exactly. And sorry, the last thing I'll
And
say,
to the right type of doctor.
exactly, say to the right
Mm-hmm.
person. Hopefully that won't dismiss your concerns. But another thing in terms
Yes.
of to your question about things that people overlook, I think because so
Yeah.
many people don't have a family doctor, getting that
Mm-hmm.
preventative medicine, you know, when
Mm,
you're not going to the walk-in clinic, usually you're going to a walk-in clinic because something is wrong, right? You've got a
yes.
pain, you've got a rash, you've got something going on. If you
Yeah.
don't have a regular family doctor, you're less likely to go to a walk-in doctor or someone who's not your regular physician for just
Mm-hmm.
prevention. Like, I'm 40. Do I need any screening test? That's not you. The
Mm-hmm.
conversation you're not having that with someone you don't see often. But if you
Yeah.
don't have a family doctor, it's still important to make sure that you're on top of those screening tests. When I think reproductive health, I think about cervical cancer screening, right? So cervical cancer,
Mm,
not incredibly, like, we don't have as high rates in Canada as other parts of the world because there is more access to screening here, which is previously pap test, now the HPV test. But we do know that cervical cancer rates are higher in women of color and Black women. And
yeah.
I think it again speaks to that whole social aspect, right? If you're not going to see a doctor as often, then there isn't
Mm-hmm.
the opportunity to make sure that you're on top of your screening. And then things are missed.
Mm-hmm.
Because this is a very preventable cancer. Like, no one should be dying of cervical cancer.
Mm,
But if you're not getting screened
yeah.
because you don't have a regular doctor or no one's talking
Absolutely.
to you about it, same thing with breast cancer, right?
Mm-hmm.
Like, it's now age 40, so
Yeah.
getting your regular mammograms. And it's hard to be on top of those
Yeah.
things, but you don't have someone who's on top of them for you, right? If you have a regular family
Absolutely.
doctor, like for me, I got all my alerts coming up, like, oh, this person, alert, you're due for this. So I send you a message. Here's your
Mm-hmm.
requisition. Like, here's all that. But when you don't have that kind of
Yeah.
like quarterback for your health, it kind of falls to you. And it can be
Yes.
hard to know what you're due for and at what times. So I think
Mm-hmm.
people, which is the majority of many people, if you don't have a family doctor, feeling comfortable going in to see a walk-in doctor or a nurse practitioner and being like,
Mm,
I'm 45, I'm whatever age, is there any screening or preventative health care that I should be doing at this time so that we can decrease
that's
rates
a
of
great
cancer,
idea.
especially in Black communities, because a lot of cancers are higher risk in Black communities. So, a reminder
Absolutely.
for people.
Absolutely. And I love that intentionality
Mm-hmm.
that you just mentioned, right? So if you don't have that, quarterback in your back
Mm-hmm.
corner trying to remind you that you need to do these screenings, go into a
Mm-hmm.
walk-in clinic, ask the questions,
Exactly.
right? I want to make sure that everything is good,
Mm-hmm.
right? Book that physical, right? That physical examination,
Yeah, that
right?
periodic health exam. Yeah. Yeah.
Periodic,
Yeah.
but make
Yes.
sure you
Make sure you
go
go periodically. Periodically. Yeah. Yeah.
periodically,
Yeah.
As, what about like men reproductive health? So like prostate
Mm-hmm.
and like what are they supposed to be doing?
Mm-hmm.
I mean, that's the what comes to mind, but I'm not a doctor. You are the
Yeah.
doctor, so
Yeah.
you tell me.
Yeah. So, I mean, unfortunately, prostate cancer is higher risk in Black men, right? And it's
Oh,
prostate cancer screening is one of these, I don't want to use the word controversial, but there's kind of different thoughts about it. So there's a blood test, the
okay.
PSA test, which actually is not
Yeah.
covered by OHIP
Mhm.
for many people.
Mm,
And
yeah.
urologists are like, we should be screening people. But then the hereditary care
Mm-hmm.
guidelines for family doctors are just like, it's a conversation you have with the individual patient, right? So for me,
Mm,
like all the Black male patients in my practices, I've always offered them
yep.
screening because Black men
Yes.
are considered a high risk group for prostate cancer.
Mm-hmm.
But I think it's one of those things people need to have a discussion with their primary care provider. But for Black men, especially
Yeah.
considering depending on
Yes.
their family histories, I would encourage them to at least have that conversation with someone. Is this something that I should be doing? At what age? Because
Mm-hmm.
it can depend on different factors for different people. But um,
Yes.
that is something that people should be on top of. But I think
Yeah. And
especially for Black men and Black women,
mhm.
something that people often I don't
Yes.
think about as much is like rectal cancer, so like bowel cancer,
Yeah.
right? So really making
Mm.
sure that you're on top of screening for that. Usually it starts at age 50. Um, Really
Mhm.
easy test. It's just like a stool test, super quick. You do it every
Mhm.
couple years,
Mhm.
but it's so important to be on top of these screening tests because so many of these cancers can
Yeah.
be prevented or caught really early with screening
Yeah.
versus when you
Mhm.
have, a lot of symptoms and it's really late in the course of the cancer. So
Yeah.
there's just so much we can do, and I think we're really lucky. I talked about the problems with our healthcare system, but we actually are lucky to
Yeah.
like in a
Yeah.
country with really great healthcare once you can access it, right?
Yes.
I think it's up to
Yeah.
us to take advantage of, what we have access to.
Absolutely. Absolutely. And I know that you mentioned 50 for like, the rectal exam and, getting screened for
Mhm.
the prostate exam. And then for women, should be around the age of 45. So, what are like so is it around the age of like 40 to 50 that we want to be doing more of these types of tests? Because,
Yeah,
age one day you're like 21 and then you turn around and then you're like, wait a second, I'm not as young as I
right.
used to
But you
be.
still
So
feel
we don't
young.
really
Yeah,
think about these
yeah,
things. Ish.
ish. Yeah,
Ish. Yeah.
yeah. I would say an easy way to remember it is that 40 is when we start screening for a lot of things. So for women, I
Okay.
mean, cervical cancer starts at age 25. So that's the one that's a bit earlier. Beyond that, most
Okay.
things are
That's
40.
good.
So things like
Mm-hmm.
breast cancer, having that discussion starting at age 40, diabetes
Mm-hmm.
screening starts at age 40, could be earlier
Mm-hmm.
depending on people's family history, like cholesterol,
Mm-hmm.
getting that checked regularly, age 40. Again,
Mm-hmm.
people's family histories might change when we start, but just for someone with average risk of things, kind of all comers, age 40 is when we start having a lot of those discussions and starting a lot of that screening. Um, 50, that's like the colon cancer and some other things, but age
Mm-hmm.
40 is when people should, I think, if they don't have a family doctor, if they're not seeing someone regularly, maybe go in somewhere and
Yeah.
be like, anything I should be doing. I think that
Yeah,
especially diabetes
absolutely.
screening and cholesterol
Yeah.
screening is something that's missed often when people don't have a regular
Mm-hmm.
doctor. And again, things that we're at
Absolutely.
higher risk of. Yeah.
Absolutely. So I know there's probably some listeners out there that are hearing the words like screening
Mm-hmm.
and assessment, and it's making them even physically uncomfortable hearing that. And there's different reasons why people may avoid getting these physical types of exams. Or I don't. When you say screening, that's what I'm thinking.
Mm-hmm.
Physical. It could be just question. I don't know
Yeah.
because you're the doctor. No. But like for some people I know, some clients, it's because they've been like sexually
Mm-hmm.
abused, or like there's so many different reasons why people may avoid the physical aspect of these
Mm-hmm.
exams, right? So what would you say to the Love Bay family that they feel like maybe there's something wrong but they feel scared
Mm-hmm.
to go get it checked out?
Absolutely. I think, yeah, it's hard because depending on your life experience, a lot of things might come with trauma, right?
Yeah.
And be triggering.
Yeah.
Um, I
Hmm.
think the good thing for a lot of the screenings that I'm kind of talking about is that they're not physical
Hmm.
exams, right? Like
Did you hear that? It's not all
it's not all
physical.
physical.
Yeah.
Yeah. So things like, diabetes, cholesterol, that's blood work. And again,
Yep.
if you have a needle phobia, that's a whole other issue. But those are blood
Yeah.
tests. You should get your blood pressure checked, you know, and like periodically starting at age 18. That's, I guess, kind of
Yeah.
physical, but I think I think people are thinking there's a lot more like physical things involved in screening. But
Yeah. Hmm.
like the HPV test, screening for cervical cancer, that is a physical exam, and that is for many people
Yeah.
uncomfortable. And if there's a history of
Yeah.
sexual assault, that can be very triggering and very
Yeah.
uncomfortable for people.
Hmm.
I think that's an
Hmm.
exam that you really want to try to find someone that you trust and feel as comfortable as
Hmm.
possible with. That's a time when it could be
Mhm.
helpful to take a support person in with you in case,
Mhm.
some of those feelings do come up and you want to have someone
Yeah.
there that you feel comfortable with. Um, and just,
Mhm.
yeah, I think trying to find I think it's really good. It's important to find a provider that you feel comfortable with for that kind of exam for anybody, but especially if you have
Absolutely.
that kind of history. Um,
Absolutely.
that can be hard. And the good news is, eventually, hopefully,
Mhm.
that's going to be a self test, and you won't need to go into the doctor. And
Really?
yeah, so BC,
Ooh.
so because in Ontario we switched from the PAP test
Mhm.
to the HPV test
Yep.
in March of this year.
Okay.
Unfortunately, that makes no
Oh.
difference to you as a patient. It's the same thing. It's the same procedure. It's
Mhm.
the same speculum. It's the
Mhm.
same swab. You notice no different. But in BC, they
Mhm.
actually rolled it out last year, like before us, and it's a self test. So they're piloting it in
Mhm.
Ontario where it'll be a test, like you can just do it on your own,
Mhm.
and hopefully that will
Mhm.
be rolled out. I think they said the next few years, but eventually it'll be a
Mhm.
self test, and you won't need to go see a doctor for your regular cervical exam or cervical screening. So many of these things,
Wow, that's great.
they are moving more towards like self-directed things, like the rectal or the bowel cancer screening, the colon cancer screening. That
Yeah.
is a test you do at home, right? It doesn't involve a physical exam.
Mm.
You take two sample at home,
Wow.
right? Everyone thinks like colonoscopy.
Mhm.
For screening, if you have no
Yeah.
risk factors, it's a stool test. You don't need to go in and have a colonoscopy if you don't have any symptoms. So
Yeah.
I think don't let fear of the physical exam prevent you from doing all of this important
Mhm.
I don't even keep using the word screening, but making sure
Yeah.
it's okay, right? Because
Yeah,
many things
absolutely.
there's no physical exam. I mean, obviously mammograms are not comfortable, but many
Yeah,
other things there's no physical exam.
absolutely. So you hear that, Love Bay
Mm-hmm.
family? Don't let the fear hold you back. Things are advancing,
Mm-hmm.
right? Where we're able to do things in less invasive
Mm-hmm.
ways. It's from what it's sounding like.
Yeah.
So don't let the fear of the procedure or what it looked looked after deter
Mm-hmm.
you from getting treatment.
Yes,
Okay.
absolutely.
See, you heard it from the doctor yourself, right? And so that to ask about the mammograms, right? So
Mm-hmm.
why are mammograms so uncomfortable?
Why?
Yeah, like I mean I don't know. Yeah.
Yeah. Why? So I mean, maybe they'll have a better tool in the future, but so
Yeah.
mammogram is like a type of X-ray, and unfortunately, it has to like squeeze the breast to
Uh
get the image,
yeah.
right?
Oh,
So
I
it's one of those
see.
things. It's often more uncomfortable as people get
Mhm.
older because
Yes.
when we're younger, we have a lot more fatty tissue, and so it's
Mhm.
not as like it's just not as
Comfortable.
uncomfortable oftentimes. But as you get
Yeah.
older, you lose that fatty tissue, and the breasts, um, it's just more of a squeeze, if that makes sense.
Okay.
But I
Okay.
would say, I think if people have never had one, it
Mhm.
often isn't, I think, as bad as people are envisioning. It's not
People
comfortable,
hear the stories and then you're like, "What?"
right? No, personally, like I'm happy to share, like I've had mammograms because there's a family history
Okay.
of breast cancer in my family, and
Okay.
I thought it was going to be a lot worse. It
Yeah.
wasn't amazing, but it wasn't very
Yeah.
long,
Yeah.
and no, there are worse things.
Hmm.
If
And
I can
how
do it,
often
then I
should
can do it.
women be checking themselves, even like
Hmm.
their own like breast examinations?
Hmm. Yeah, so the current recommendation is called breast self awareness. So not about
Mm-hmm.
having to do like a specific exam like once a month or
Mm-hmm.
at a certain time interval. It's more about being aware of what's normal for you
Mm-hmm.
so that when you notice something different, you notice it. So just,
Yes.
making sure that you know what things feel like when you're showering or that kind of thing, having a
Mm-hmm.
bit of a feel every once in
Mm-hmm.
a while. And if
Okay.
something doesn't feel right, or you notice something's a bit different, or skin change, maybe it's like nipple discharge, that kind of thing, then seeing a
Mm-hmm.
doctor like as soon as possible. But it's more just breast self awareness. You don't need to
Mm-hmm.
do like a specific type of exam at certain intervals,
Mm-hmm.
if that makes sense.
That makes sense. That makes
Okay,
sense.
good.
So it's more just making sure that you understand what feels right, and then
Yes.
that way, that if there's something that's abnormal, then
Hmm.
a red flag will be like, oh, that's strange. I should get this checked out.
Exactly. Exactly.
Hmm.
Hmm.
So you know what? We got some extra time, 10 to 15 minutes, right? We got the queue.
Okay.
Right? So, I mean, Love Bay family, the chat is open. Like, if there's any questions that you have, feel free to pop it in the chat while you can,
Hmm.
because Dr. Duarte is wonderful, and she'll answer to the best of her ability here. But I think, again, like tonight, I really want to strike it home that don't let fear hold you back from either advocating for yourself, right? Or to, when you recognize that something is wrong, that you take that courage, right, to go seek out health care. Because, and even with your mental health, even,
Hmm.
your mental health, if you feel like there's something that is off, please go to a family doctor. And if the family doctor isn't telling you what you need to hear, it's okay to get a second opinion.
Hmm.
One of the final questions that I wanted to ask about is this whole idea of medication, because I know that a lot of people in our community is iffy as it relates to medication in general,
Hmm.
right? So, like, I know that even with some clients that see me, a lot, I see a lot of clients that are in therapy for the first time, and from what
Hmm.
they've said, they've avoided seeing a therapist because they feel like we're going to just try to medicate them. That's outside of my
Hmm.
scope. I don't medicate
Right.
nobody, right?
Right.
So, if I see that there's any like red flags or something that may need the assistance of a family doctor, I will be like, I think you should see your family physician for this,
Hmm.
right? But what would you say about this whole medication piece and the hesitancy to
Hmm.
get treatment because you're afraid that you're going to get prescribed something that you don't want to take?
Right. Yeah, I think it's a really valid concern. And I think if you
Mm-hmm.
look at the history of the medical
Yeah.
system in
Mm-hmm.
North America and the in Western world, there's so much, um, there's a strong history of experimentation, like,
Mm-hmm.
like experimentation on Black bodies against people's
Yes.
wills. And so I think the
Mm-hmm.
distrust in pharmaceuticals and medicine is not unwarranted.
Yeah.
But I think we're fortunate that in 2025, we have so many really effective medications.
Mm-hmm.
And I think many family doctors, medication is not the first line of treatment for many things. There's
Yeah.
some things that it is, right?
Mm-hmm.
Like high blood pressure, you want to do some lifestyle changes, but many people, especially Black people, we will need medication.
Mm-hmm.
But I think, especially with mental health, therapy is just such an important factor. And for many people,
Absolutely.
that can be the main treatment. But
Mm-hmm.
sometimes it is about the, sorry, my dog is chewing on something.
That's okay. That's okay.
But sometimes it is about, augmenting or
Yeah.
supplementing therapy with another really effective and well studied, well researched tool.
Mm-hmm.
So, and many medications, depending on the concern, it's not about having to take it lifelong.
Yeah.
It might just be something to help in that time and then
Mm-hmm.
hopefully kind of getting you off of it. Some things are
Absolutely.
lifelong, but some things aren't. But I think it's always just important to hopefully have these conversations with someone that you trust, like a trusted
Yeah.
healthcare provider, and
Absolutely.
then, making sure that you're finding something that's right for you. Because not all
Mm-hmm.
medications are going to be right for everybody. So it's about
That's right.
finding, something that works best for your body with minimal side effects.
Mm-hmm.
Um, and for many conditions, hopefully there is an option for people. But
Mm-hmm.
we're not trying to just medicate everybody. We
Yeah.
want to treat you, and
Yeah.
sometimes the treatment could be medication, but oftentimes it is like lifestyle stuff that might
Mm-hmm.
be combined with medication. But I
Mm-hmm.
definitely understand the distrust and the hesitancy for sure. I think it's a conversation I have all the time with people.
Absolutely.
Yeah,
Absolutely. And again, I think that this is where self advocacy ties in, right? Because,
exactly.
just because maybe it's suggested that, okay, maybe you should take this medicine, you can speak up and say, actually, I don't know if I want to try that just yet.
Exactly.
What are the alternative options? And that's
Hmm.
okay, right? Again, your body, your voice, right?
Exactly.
And so, if you try different things, all the alternatives, and then it's still not working, then you and your family doctor can have another conversation of what next
Hmm.
steps could look like. But you can still advocate for yourself. And like you mentioned, Dr. Duarte, it's not always like the
Hmm.
first line of defense, right?
Yeah,
There's other things that you can try first.
exactly. It's often not the first line of defense.
Did you hear that? It's often not the first line of
Hmm.
defense,
Yes.
right? And
Yeah.
so, if that's a fear that you have, rest assured that, again, if you use your voice, you know, it doesn't have to be a reality where you have to take medication first. There are other options
Exactly.
out there for you.
Exactly.
Amazing. Well, Dr. Duarte,
Hmm.
if you could leave any last thoughts with the Love Bay family tonight, what would you leave with us?
Yeah, I think the recurring theme to really just drive it home is don't be afraid to advocate for yourself
Mm-hmm.
and for your health.
Mm-hmm.
You your health is just so important and
Yeah.
such a huge part of everything of your
Mm-hmm.
life, of your longevity, of literally all parts of you. So
Yeah.
you need to be your own biggest advocate and overcome any doubt or shame or lack of confidence to make sure that you are getting the care that you deserve. So
Mm-hmm.
I think I've said that so many times,
Yeah.
and I really just want to reemphasize how
Yeah.
important that is. And if things don't feel right, trust your gut.
Mm-hmm. Well, there you have it, Love Bay family. If things don't feel right, trust your gut. And it's okay to advocate for yourself. So until next time, Love Bay family, next week is She Speaks with Cheyenne Scarlett. It is going to be wonderful. So until next week, peace out.
Bye.